Well, good day, everyone, and welcome to the Group of 78's annual policy conference, this year focusing on what needs to be done to adapt to the increasing impacts of climate change. My name is Richard Harmston. I'm the past chair of the Group of 78, one of the signatories to the original advocacy letter 40 years ago that launched the group, and a member of the working group on climate change that has organized this conference. I'm speaking today from Ottawa, which rests on the unceded territory of the Algonquin Anishinaabe people, the original stewards of this land. Our online conference is continuing, launched last week and going on for the next 2 days with substantive presentations and dialogue. Then wrapping up on October 5 with an opportunity for participants to discuss the draft of the conclusions and recommendations emerging from these sessions. This document will form the centerpiece of the Group of 78's advocacy to government and other sectors on adapting to climate change. Today's focus is on health, and to delve into the question, how do societies and their governments prepare to meet the health challenges created by climate change? These problems range through increased respiratory and cardio illness, the spread of Lyme and other diseases, the incidence of pandemics that we just lived through and are living through, injuries from major weather events, greater mental stress and disorder, damage to medical facilities and health services, malnutrition and starvation, and degradation of the social and environmental determinants of health. How do we in Canada and globally address and manage these challenges now in the years ahead? We have a stellar panel of 3 people lined up for you today, and to introduce them and to moderate this session, I'm happy to turn the session over to Professor Christopher Huggins. Sorry, Chris. Chris is the Associate Professor of International and Development Studies at the University of Ottawa. His research focuses on agricultural development, rural livelihoods, and natural resource management in Africa, particularly in post-conflict situations. He has consulted for major UN agencies and international non-governmental organizations, worked with Human Rights Watch, and was for several years a research fellow at the African Center for Technology Studies in Nairobi. He has a PhD in geography and specialization in political economy from Carleton University here in Ottawa, and a master's degree in environmental studies from Strathclyde University in the UK. He has authored and edited several books in many journals. With his teaching on food security and environment, Chris includes modules on food security and health and treats climate change as an omnipresent, cross-cutting issue in his courses. Chris, thank you very much for joining us in this role of moderator. The mic is now yours for the rest of the session on health and adapting to climate change. Over to you, Chris.
Thank you very much, Richard, for that generous introduction. And I think you've already started to mention many of the issues we'll be talking about today. So thank you again, Richard, for that intro. I'm delighted to be moderating this session. As Richard mentioned, we have 3 very experienced and very well-placed speakers to talk about our topic today. I don't want to say too much in the way of introduction. Richard already outlined some of the issues and the challenges related to the links between climate change and health. We've also been talking, in this conference for several days about adaptation more generally. I guess just to set the scene, I'll say very briefly that perhaps our mindsets or our ways of looking at climate change have shifted, I think, over the last little while. And I think part of that might also be because of our experiences in the pandemic, which Richard also talked about. I think, those of us who have been working on perhaps international development issues or climate issues have tended to see, and the general public have tended to see climate change as something which is to be tackled in the near future. So working today to avoid problems in the near future. Whereas in the past few years, I think it's become very, very clear that the impacts of climate change are very much with us. And for some people, they're living them on a day-to-day basis. So this is something which is happening now, and we are struggling to keep up with events on the ground right now. I think another kind of a myth, or another part of perhaps our sometimes unspoken assumptions around the impacts of climate change are that these are, primarily or only going to be catastrophic in the global south. Whereas increasingly, I think we've seen, parts of the global north experiencing, whether it's extreme heat events in Europe, whether it's wildfires in Western Canada and the west of the United States as well, whether it's so-called natural disasters, which we can no longer call natural because they're all partly anthropogenic. We are experiencing these in the global north as well. So this is a global and a human crisis, although, of course, certain places are affected more acutely than others. And I'm looking forward in this session to, I think, finding out a lot more about not only some of these acute issues, the diseases which strike us at a global level, and these natural disasters which have their very obvious impacts, but also the kind of slow motion disasters, the health impacts which are more chronic, which still kill people in the thousands, hundreds of thousands, but are perhaps less visible in the global media. So I'm really looking forward to this session. So I'm going to introduce each of our speakers briefly. I think all of the participants today have access to their full bios. Okay, so I'm going to say a little bit about each speaker, and then I'm going to move to our first speaker for today. So our first speaker is going to be Janet Hatcher-Roberts, who has over 30 years experience in bridging communities, evidence, and policy, both nationally and internationally. She is currently the co-director of the WHO Collaborating Center on Knowledge Translation and Technology Assessment for Health Equity, a Bruyère Research Institute at the University of Ottawa, where I'm also based. She is an adjunct assistant professor in the Faculty of Medicine, School of Epidemiology and Public Health, also at U Ottawa. Through her work at the WHO Collaborating Center and the university, she teaches courses on health systems and global governance and carries out research focusing on equity, health systems, and global health. Our second speaker today is Didacus Namanya. Mr. Namanya is a skilled senior health geographer with over 20 years of experience working at the Ministry of Health in Uganda. In this role, he is the focal person for climate change and human health, and he is in charge of public health mapping and geospatial analysis. He has spearheaded the articulation of climate change adaptation in national health policy in Uganda, and has also headed up strategy development and intersectoral collaboration with various health-related ministries and agencies. And our third speaker today, again, an extremely experienced person, Nicholas A. Robinson, who has been working on environmental law issues since the 1960s. I won't go through his entire bio, but I can say that he taught the International and Comparative Environmental Law courses at Yale University for 2 decades. He also taught at University College London and at the National University of Singapore. He is currently the executive governor of the International Council for Environmental Law in Spain. He also serves on the board of the Environmental Law Institute in Washington, D.C., and he is the Gilbert and Sarah Curlin Distinguished Professor of Environmental Law and University Professor for the Environment at Pace University. All right, so with those intros complete, I'm going to turn over now to Janet Hatcher-Roberts. And Janet, you have 15 minutes, and I'm looking forward to your presentation. Welcome.
Great. So thank you so much, Chris. And as you said, I'll be talking about things probably more from a health systems approach, but also, as I've heard over the last 3 days, the word resiliency. And I really would like to emphasize building resiliency for adaptation, because that's really where we need to focus, I believe, when we're talking about adaptation. So Martin Luther King was heard to say that of all the forms of inequality, injustice in health is the most shocking and the most inhumane. And the challenges for us to build resiliency for adaptation to climate change are the things that we need to really start thinking about. So what do we mean by equity? Well, not equality. Equality is everybody has the same platform. Equity means we support those who are more vulnerable. The reality is that the inequities are huge and growing. And equity really is a justice issue. It's a moral issue. And so if we're truly looking at justice, we would tear the fence down. So the world is not flat. This is how we see the world when we were in grade 5, grade 6. But if we look at the distribution of the world's population, we see that clearly there are some countries with massive population and others without. If you take that as the denominator and you look at the distribution of the world's wealth, we see some massive inequities in distribution of wealth. Africa, that little appendage, India, Bangladesh, Japan, quite a swollen grape, US and Canada, a little sliver, but let's not forget that's population. And inversely, poverty. And even though Africa's population is smaller than, say, than India, the impact of poverty in a relationship to population is massive. So if wealth's not distributed fairly or equitably, will health be, and that which determines health and resilience to adapt be distributed fairly or equitably? So some of the emerging health challenges very quickly, the main health challenges for those over the age of 50 are the same around the world, and that's non-communicable diseases. Many of you may think, oh, it's all infectious disease, but we're moving through in most countries what we call an epidemiological transition. So some of the connections to climate change are the big killers: heart disease, stroke, chronic lung disease. There's relationship between stress, access to healthy food, and pollution to some of these diseases, but we're still trying to figure out what the relationship is and the power of that relationship to climate change. Some of the greatest causes of disability: visual impairment, dementia, hearing loss, osteoarthritis. There's some evidence that certain forms of dementia may be related to climate change, but we're still starting to study and discover the strength of those relationships. An aging population is huge across the globe. I hope it's looking at quadrupling by 2050. And in low-income countries, this is a challenge because many of the older people are left by their young families to go and seek economic improvements, and they're isolated. And when you look at the impact of climate change, heat, drought, access to water, those are further inequities that will impact our elderly globally. So we've heard many people over the last few days have talked about a coordinated policy response. The Sustainable Development Goals are thought to be the way forward, but they're competing against many vertical programs addressing health conditions and conditions rooted in poverty, conflict, rapid climate change. So many organizations are focused vertically. So the capacity to assess the needed resources, monitor and act is a challenge in this competitive field, even with the SDG movement. And I just summarized them. I know many of you are very familiar with them, but for us in the health sector, we were familiar with them. These were our social determinants of health that we've talked about for 30 years. And in most of the SDGs, there's a relationship to health. And so for us, the social determinants of health are the SDGs. Now, we didn't call it climate change. Back then, we called it environment, but they're clearly there. Now, a health system is one of those social determinants, but it's clearly not the most important one. And yet, there's huge inequities, even when you look at the access to clean water. When you've got 660 million people living on less than $2 a day, and they've got to pay for health, food, transportation, books, school uniforms, it's no doubt they lose out in accessing the clean water. So COVID really emphasized our worldview of the interrelationships between humans and animals and economics. Who would have thought we would be running out of paper towel, that we would be running out of sanitizer, and getting oxygen to our hospitals? People who never thought about these interrelationships were starting to understand them. And understanding what public health was and epidemiology, for the first time, people knew that I wasn't looking at skin diseases. So it was quite a victory for me. And so over time, we started to think about, and we started to understand climate change and biodiversity collapse. And people, I think, really, we've started to really understand these relationships a whole lot better through this horrible pandemic. And we've been able to think about these relationships. So why do we need to adapt? What do we know? Well, many of the diseases are clearly associated with poverty. 25% are in the developing world or low income is due to environmental factors. 2 million people, mostly women and children, die each year from exposure to indoor air pollution, which is cooking with fossil fuels, wood, dung, charcoal. And many non-communicable diseases, as I said, have some relationship, but we're starting to try to build that evidence. When you look at deaths related to environment, it's about 12.6 million. When you look at DALYs, which is disability adjusted life years or life expectancy in good health, you have over 596 million disability adjusted life years, or 21.8% of total related to the environment. So it's quite significant. And we have these converging paradigms of what in the old days was called environmental health and now planetary health. So we're moving from prevention and focus on risks to looking at planetary health, which is really looking at the impacts of global change. And we're starting to try to bring those two paradigms together as we do our research and thinking in this area. And so many people have given definitions of adaptation, but it really needs to be seen as part of a continuum. It's not preferred against prevention or mitigation. They are a continuum. And it's great we're talking about adaptation, but we also have to talk about mitigation. We also have to talk about prevention. It takes many shapes and forms. It has unique contexts in business and community. And we heard from all of these examples, no one size fits all. And that's been fascinating to hear. And it doesn't just depend on government. It's all stakeholders. We've heard about the role of NGOs and civil society and how important that is. And certainly from our perspective in the health sector, this is incredibly important. So if we look at a systems approach for health, we've got the healthcare delivery system in the pink and the blue, service delivery, community-based interventions. We've got components of the health system, evidence-based decision-making, health information systems, human resources for health, financing for health. But then we also have to think about what are the social determinants, the poverty, education that have an impact on that, and what's going on in the other sectors. Transportation policy is a better predictor of maternal mortality than the healthcare sector. You got a good road, you can get the woman who's hemorrhaging from A to B. You don't, you could have the best doctor at the end, but if you don't have a good road, it doesn't matter. So we have to work with those other sectors to build a more resilient and interactive system for health. And of course, based on a foundation of a vibrant and safe civil society and a transparent, accountable public and hopefully private sector. That's more difficult sometimes. So if you're looking at this, we have to have this interrelationship with the policy domains for the planet. And we need coherence, and that's what we don't have right now amongst policies and sectors to support the adaptation efforts. And what's significant to me is that community understands this. When they look at indicators for planning and resource allocation for their communities, those issues come up automatically, and they work together, the mayors, the nurses, the advocates. And when they came up with the indicators for planning, they were not talking about hospitals. They were talking about water. They were talking about nutritional support. They were telling the mayor to not build the basketball court, but to build latrines. So they developed their priorities, but they also had access to their data. And this is what's so important. But the world is fragmented. Just in the health sector, you've got all these different donors with different indicators, different demands at the community level to collect the information. But the communities don't feel they own those data. But if they do know they have access to the data and they can link it up, then they can start planning and taking action. So if you take a look, finally, this is my last two slides about kind of a checklist for how you would go about adaptation process. What are the social determinants which have a significant impact on our ability to adapt to climate change? What other sectors do we need to be interacting with? What are the policies and regulations in place? And based on what evidence, so that we know which ones are interacting? How is the human resource situation affecting our ability to respond and adapt? And what cadre should we focus on? Clearly, it's not doctors. It may be nurses. It may be community health workers working with extension workers. Health financing. What's the underlying investment in the healthcare sector? And how does that impact on our ability to adapt, to treat, to manage the health impacts? Clearly, that's important. And then we do talk about our health information system and our management information system, but how are those other information systems in education, environment, immigration, how do they interact? And are they within the same administrative frame or boundaries? And Dita, you will know this, that when you're trying to use GIS mapping, it's lovely to be able to bring those different data sources together to then see whether there's a health impact or a social impact. But also often these administrative boundaries are not aligned. And it's wonderful to bring that data together in a visual way for communities. They own it, then they can take action at a granular level. What research is taking place? What are the ethical issues? Who's being funded? Who funds it? And who's defining the research questions? Is it the Global South or is it us funding it? The role of NGOs, who should fund the extra demands? Are NGOs part of the dialogue? And that was emphasized. And what's their role in adapting and providing assistance to build resiliency? And finally, we've talked about many of the sectors in the last week. And we really need to understand what they're doing, what they're planning, what they're financing, how does that interact? And we rarely sit around the table at a donor level to understand that. And finally, within that is, of course, the role of social media, building the trust for decision makers, building the trust for communities and individuals to be able to understand the evidence and make the right decisions without being influenced by the misinformation that's occurring in the social media, which has such incredible impact on the way we will attack climate change and the way we will deal with adaptation. So 3 take-home messages. Equity is a foundational aspect of adaptation. Resiliency is critical to our ability to adapt. And we need to rethink what we mean by prevention. We thought things like cyclones and earthquakes were not preventable, but we need to think of that in terms of its relationship to climate change. Thank you.
Thank you very much, Janet. Thank you, first of all, for keeping very, very well to time, but more importantly, for, I think, using that time to make a number of key points. You said so much; it's hard to sum it up. But I think, paraphrasing, you argue that the social determinants of health kind of approach has really identified the environmental dimensions, and potential linkages to climate change for some time already. But the key issue that you were raising was operationalizing this, especially through intersectoral partnerships and linkages. Where to intervene, what kind of levels are those connections best made? You raised, as you said, equity, resiliency, and rethinking prevention as your three takeaways, but I thought it was also very important that you mentioned justice as a key issue right at the beginning. So I guess if we're talking about financing some of these actions, kind of a global justice approach as well might guide us in terms of which countries and which actors are funding some of these kinds of interventions as well. So thank you so much, Janet, for that excellent first presentation kicking us off today. I should mention, I'm sure all the participants now know this because you may have been taking part in other sessions in this conference. But if you do have questions, please use the Q&A mechanism there. You can put them in there, and at the end of these three presentations, we'll make sure that all your questions are answered. Okay, so we'll be looking for some things popping up there in the Q&A. All right, Mr. Namanya, I'll let you take it away for our second presentation, please.
Thank you, moderator, distinguished participants who are listening in. Ladies and gentlemen, it's a great opportunity to participate in this G78 conference and share with you some of the points and views about climate change and health, especially in the global south. I come from Uganda, which is at the center of the African continent, and it's quite interesting that we are already facing climate change impacts. My presentation will I will give a brief background about climate change and health. I will look at the effects or impacts of climate change and go on to see how the health system can be strengthened to adapt to climate change impacts. I'll go on to see how developed countries like Canada and the global north can assist or can support adaptation initiatives in the south. It's really looking at how we can work together and reduce the impacts of climate change. We know we are living in the same planet and we need to protect it, whether from the mitigation approach or the adaptation approach. These are two twins, and we cannot do adaptation without looking at mitigation. They have to go together. I will go on to give final messages, key messages from my presentation. Now, to go on to the background, I think climate change affects the social determinants of health. And my colleague Janet has already articulated this. Things like clean air, safe drinking water, sufficient food, secure shelter, all these are affected by climate change extremes. If you talk of flooding, if you talk of landslides, and we have experienced all these in big amounts in the global south and Uganda particularly. We have hilly areas in Uganda, in the eastern and the western part of the country, and you find with heavy rains and abnormal rains, flooding can cover, destroy villages with many deaths and destruction of health infrastructure and so on and so forth. So it is generally recognized that protecting health from impacts of climate change is one of the defining challenges of the 21st century. I think there is no doubt about that. In the COP meetings, the current COP26, adaptation is high on the agenda. And it is really recognized that health is a new agenda. The only issue is that health generally is on the extreme end of the adaptation. Climate change is largely seen as an environmental issue. So therefore, efforts of climate change interventions and adaptation are largely health associated, are not put on the front of the agenda. It is also recognized that areas with weak health infrastructure, especially in the developing countries in the South, are the ones most affected. Yet they are the least generators or emitters of greenhouse gases, which are driving the climate change impacts and extreme weather events. Let me now go on to the effects and the impacts. These have already been articulated somehow. The famine, for example, the increase of communicable climate-sensitive diseases like malaria, like diarrhea. In Uganda, for example, we have regions which did not have malaria because of the low temperatures. We used to call them the Switzerland of Uganda. The temperatures were very low and they were referred to as malaria-free zones. But I can assure you now they are epidemic-prone malaria regions in the southwestern part of the country. So they are driven, the epidemics of malaria are driven by climate, the increase in temperature, where the mosquitoes can survive. We have physical injuries. Janet has already mentioned them. The deaths, massive flooding causing massive destruction of crops, droughts which come and destroy crops, and there is famine all over the country. All these cause poor nutrition and starvation in many parts of the country and the global South. Destruction and destruction of health infrastructure. We have population displacement, where people need key infrastructure like sanitation, safe water, and there is outbreak of water-related diseases like cholera, like dysentery, which kill a lot of people. There is another important aspect of climate change, the mental health concerns of both the communities and the health workers who deal with these challenges of dealing with injured people, people who have died out of these extreme weather events. They are affected mentally and it stays with them forever. They need to be treated in a special way. Let me now tackle the issue of how can the health system be strengthened to adapt to climate change. This question requires collaboration from the grassroots, the communities who suffer the brunt of the climate change impacts. It requires collaboration from the national governments. It requires the subnational governments. It requires the international community, the North, the South. We need to work together because we are working to salvage, to protect our planet. Because if we don't, then it will just disappear and it will. So one of the key things as far as health is concerned, we need to conduct health vulnerability and adaptation assessments. This is a key first step in planning so that we can properly tackle the climate change impacts. That will help us to develop climate change and disease early warnings, develop health national adaptation plans. And in this area, the World Health Organization has prepared proper guidance in how to do the vulnerability assessment, how to develop health national adaptation plans. These are things which we need to do in order to strengthen the health system. We need to create policies, national policies. In Uganda, we have been able to develop a national climate change policy, 5-year climate change policy. And the health sector is well articulated in that policy. The strategies, for instance, doing vulnerability assessment, but there's a challenge, and I guess other developing countries in sub-Saharan countries are facing the same challenge. The funding to develop the national health adaptation plans, the funding, additional funding. Because health sector, we have priorities geared towards disease, prevention of disease. So climate change is a new area which requires additional funding from the traditional budget lines. So these are areas where we can focus on and fund, maybe with support from the North, to develop these systems that can strengthen the response to climate change in the health sector. Then there is another important aspect of promoting indigenous knowledge. People have lived with the changing climate, with flooding, with the extreme heat for so many centuries. But we need to document this and popularize this and disseminate this so that the good practices, the lessons can be extremely used by the population in order to improve adaptation. Now I come to another point of promoting research. We need to promote research, in particular in the health sector, and we need to have research on climate change in the health sector to base planning on evidence. I think Janet mentioned this in her presentation. We need to have proper evidence to help us, have proper plans, like early warnings for the different diseases, so that we plan properly. Coordination is another area. This touches on the building block of the health system, which is governance and policies. We need coordination. Climate change is multi-sectoral. It touches on many sectors: agriculture, tourism, trade, transport, and these sectors also have an impact on health. So there is a need for coordination between these sectors so that we can properly respond uniformly in a multi-sectoral way, so that we strengthen our response systems. Let me now go on to look at how can developed countries like Canada, USA, and others help in strengthening and supporting. These are the ways, the things I've mentioned previously. The North, Canada, and other developed countries can support vulnerability assessments, can support the development, provide the science, because it is well developed in those countries, science of early warning and climate science, and how it affects health indicators, build strong surveillance systems in our countries, build strong health infrastructure, which is climate proofed, support the use of clean energy. There are already well-developed systems and equipment which can help us share in the climate change jargon. We call it transfer of skills and technology. The highly developed countries can help transfer these technologies to developing countries so that we can strengthen our health systems. We can also support the use of clean energy, solar and wind, and documentation and dissemination of indigenous knowledge in climate change response. What messages do I have finally for take home for our participants and our stakeholders in the health sector? I think it is very important to promote partnerships in adaptation. For example, the North-South partnerships between developed countries and developing and middle-income countries. Then it is important also to promote public-private between governments and the private sector. Companies, for example, the oil companies who generate a lot of revenue from fossil fuels. They need to, partner with governments, the health sector, and other sectors to develop, to support the adaptation strategies and support resilience. And this can be the areas of research, policy development, strategy and implementation and building back better initiatives. The last message is to support adaptation financing. Adaptation financing. We already know that there is some adaptation financing, but accessing this financing is a tall order. We need to change the procedures and make availability of these finances. Under the UNFCCC, a lot of initiatives have come up, but when you look at the usability of these funds, they are very highly limited because of the stringent measures. So we need to work on the ways that can help us, access these funds, and especially in the health sector, it is not accessing these funds. The environmental sector, because it is the lead in the climate change area, it is accessing these funds. So we need to find ways of how the health sector can access these funds, build resilience, build adaptive capacity. I rest my case and I thank you for giving me this opportunity. Back to you, Chris.
Thank you so much. Thank you so much again for keeping to time. I don't even have to, I haven't been giving people the 2-minute warning because you seem to be on track. So that's great. But thank you again, more importantly, for a very rich presentation. Again, I won't try and, I can't do justice to the entire presentation, but just to recap some of your main points, you really supported the social determinants of health approach, which Janet also had emphasized in her presentation. On the one hand, you said that the linkages between health and adaptation are really a defining priority for the 21st century. And I think we can see that, in the Lancet, the medical journal, and many other kind of flagship initiatives in the health sector. They have recognized climate change as the key issue. However, on the other hand, very often it's kind of the environmental framing, which, although very important, is not the only framing for this kind of question. So, as you said, sometimes health issues are not placed high up enough on the agenda. I think you gave us some very concrete cases of the impacts in Uganda today. You mentioned the spread of malaria to areas that were previously malaria-free, for example, and many other issues you mentioned there as well. I think, again, you mentioned infrastructure, the importance of access to clean water. Again, building on what Janet was saying earlier about, it's all very well to have a skilled doctor in a town, but if the roads aren't good enough to get people to the doctor, it's all for nothing. So I think this also ties into the issue of population displacement, which you mentioned. And I think, we haven't quite framed it as migration yet, but I think migration and climate obviously is a very key issue to think about. And, the health challenges of migrant populations are very often difficult to deal with. They have a great problems accessing healthcare. I don't want to say too much more, but just to flag that you mentioned Indigenous knowledge a number of times. I think it's very important. And I think that those of us here in Canada, of course, are very much aware of the both the kind of very deep, long-standing knowledge of the environment, but also of ways of keeping healthy, holistic ways of keeping healthy, including in terms of mental health, which again you flagged, which are held amongst Indigenous people in Canada as in other parts of the world, right? So I think that the Indigenous knowledge aspect you mentioned is very important. And of course, Indigenous knowledge has been not only marginalized, but very often undermined and demolished in places like Canada. So I think a resurgence of support and respect for Indigenous knowledge, looking at those intersections of environment and health is very important. And again, public-private partnerships. You mentioned oil companies. I think some people would think twice about partnering with them in the kind of climate change sphere. However, I think it does raise the issue again, which was mentioned by Janet, of justice, right? If these oil companies are directly responsible for the environmental crisis that we're in at the moment, what then is their responsibility for funding some of the key priorities which you identified? So thank you for raising all of those points. That was an excellent presentation. All right, I'm going to turn over now to Nicholas for our third and final presentation of the session. Thank you.
Thank you very much, Chris. It's a great honor and privilege to be with you all today at this important conference, examining the policies and practices for building resilience into our global climate crisis. It's an emergency. And I want to thank the group of 78 for the invitation to be here and commend it for its years of these annual policy conferences, which are tremendously important. So I've put together some slides which complement the presentations we've just had. So I'm going to talk about the pandemic as a manifestation of the climate crisis. People don't connect the two, but as the wonderful cartoons that Janet put up, the Mackey's cartoons, had the successive tsunamis, you may have noticed that the climate tsunami was being overtaken by a biodiversity tsunami wave coming right after it. And we need to recognize that we are not just in one crisis. The climate disruptions are intertwined with a global biodiversity loss, which is unprecedented in human history and evolution. And this in turn is complicated and made acutely more severe in different instances by the escalating chemical pollution that we experience. Last June, the Secretary General of the United Nations, Antonio Guterres, made the stark statement that humanity is waging war on nature, and that ultimately, since we are part of nature, on ourselves and our ability to survive. This is based on a scientific synthesis report entitled Making Peace with Nature that was submitted to the UN Environment Program earlier this year. And I urge you to Google Making Peace with Nature and read this report. It's a sobering assessment of how these three crises are all confronting us at the same time. So I'm going to speak about zoonosis. Zoonosis is the biological function in which humans and other animals exchange diseases. We've known about it for a long time. Tuberculosis can be given from us to cows and from cows to us and other diseases. And the danger of more spillovers of infectious diseases from animals to people is growing. In 2017, the United Nations Environment Assembly that meets each year in Nairobi warned us. They basically said biodiversity loss is a health risk multiplier. The more biodiversity loss in effect, the more spillovers of emerging infectious diseases will leave the animal kingdom and infect humans. UN Environment Assembly made it clear that human, animal, plant, and ecosystem health are all interdependent. They're not separate silos. You can't have a separate ministry for one without integrating with the other. And what they called for in 2017 was a One Health approach, an integrated approach, which fosters cooperation between environmental conservation and the human health, animal health, and plant health sectors. They urged us all to mainstream nature conservation and the sustainable use of biodiversity in order to enhance ecosystem resilience, and I suggest to you to enhance health resilience. The biosphere may be divided into many countries, but it is one shared set of natural systems and the home of people and microbes alike. Healthiness anywhere depends on earth care or stewardship everywhere. Chris Walzer, a veterinarian, and he works with the Wildlife Conservation Society, published a paper soon after a COVID-19 pandemic was evident, called How Do We Prevent the Next Pandemic? We observe that all health the health of all of life on this planet is interconnected, and we cannot ignore the basic links between animal, human, plant, and environmental health. And yet we do ignore those links. So the policy framework to overcome our fragmented management system of our own health and that of the planet is being called a One Health approach. And the One Health approach is the universal policy and practice of working to maintain the integrity, stability, resilience, and beauty of the Earth's biological community through nurturing interdependent links shared amongst humans, wildlife, all animals, plants, and ecosystems, in fact, all of nature. And we have to recognize that this is an interdisciplinary effort. It transcends and unites the contributions of all the life sciences for the stewardship of ecosystem integrity, the biodiversity, and the well-being of life on Earth. This is a comprehensive approach to One Health. There are narrower definitions of One Health that just the veterinarians and the doctors should work together on the possible spillovers of health when animals are consumed, for instance. But this larger holistic One Health approach has just been endorsed by the World Conservation Congress of the International Union for the Conservation of Nature. It met for 10 days earlier this month in Marseille, France. It was a meeting twice postponed. And by a significant majority, the One Health approach was endorsed. It wasn't unanimous. 20% to 25% of the nations, the governments that are members of IUCN and of the NGOs that are members of IUCN did not vote for it. And I think this suggests the kinds of problems we're going to have, just as we have tremendous inconsistencies in the allocation of vaccines and the understanding of vaccination and the role of health in coping with the pandemic's rampant phase. We're going to have similar misunderstandings about creating a One Health system for earlier stages. So when IUCN adopted its policy, this shows the screen of the vote at the time. You can find this motion or decision number on the IUCN webpage, decision 135. It emphasized several points. There are three of the considerations I'll highlight. One is that pandemic prevention is a current cross-border emergency. It requires urgent, multilateral, and ambitious mobilization of all actors, including local actors. Secondly, that if we agree that human health is a state of complete physical, mental, and physical well-being, not merely the absence of disease, but we need to look at that also holistically. What causes the breakdown of a health support system? And then finally, since you'll be talking about financing at this conference next, what are the true economic costs of preventing and reducing pandemic risks? The estimates are that, as Benjamin Franklin said, an ounce of prevention is worth a pound of cure. Working to keep nature healthy to prevent the next spillover is far more effective than paying for the effect of that spillover. So what IUCN called for were a series of actions. They want to prioritize the prevention of future pandemics by addressing the drivers of biodiversity. These topics will come up again in October at the 15th Conference of the Parties of the Convention on Biological Diversity. And the CBD is already in its working documents for that conference, is ready to move ahead on the One Health approach and endorse it. What we do not yet see is a similar preparation in Glasgow for the 26th Conference of the Parties for the Climate Change Convention. In short, some of the climate change thinking is still siloed in one category and hasn't seen the relationship to this health aspect. And the drivers are not just global drivers, they're drivers that you and I in our home villages have to take into account. Land use changes cause fragmentation and degradation. It was fragmentation that launched in North America Lyme disease, a zoonotic disease, a bacteria in this case, from the fragmentation of the woodlands. Agricultural expansion and the intensification harvesting of timber and so on needs to have a zoonotic lens to it now. And so the specific recommendations that IUCN has come up with are to develop pathogen spillover prevention strategies that are based on reversing ecological degradation and the loss of ecosystems, that we have to do that in all our actions. And fortunately, throughout Canada and North America and every other country in the world, states have adopted environmental impact assessment procedures. So you can basically adapt the impact assessment process to start to set up examinations of where spillovers are likely, where we're unnecessarily disrupting the natural wildlife habitats that are the host to possible pathogen spillovers, and what we can do to keep nature healthy as the best defense, the most comprehensive defense against another pandemic like COVID-19. To do that, we need to improve technological capacities. As Didacus pointed out, there's a tremendous need to build that capacity in the global south. There are roughly 100 laboratories in North America and Europe that can work on epidemiology of these spillovers. And there are only about 7 of them in the developing world. There's one for Africa and Nigeria. But we need to have 100 throughout Southeast Asia, South America, and Africa. So this should be a high priority. And the ones that exist in the North should partner with institutions like Makerere University in Uganda to start building up such presence in the global South. And then finally, the reason we don't treat these 3 crises as connected is, frankly, ignorance. We have to strengthen awareness raising and education on the interconnectivity of all of life if we're going to prevent the next spillover. So what are the implications for governments? Well, at every level of government, from the local city or village up to the province, to the national government, and to interregional and international ones, we need to establish a new cabinet level or highest level eco-security council, where all the stakeholders come together, and we don't just have a lecture series that says, well, the transportation sector is as important as the ultimate supply of the health service. But we never put the transportation sector together in the same place. We have to stop doing that. We have to put eco-security as a cross-sectoral objective of all our ministries. And we can't forget that the public is also key to that. It's not outsourced to government. It must be in partnership with the public, as the Principle 10 of the Earth Summit in 1992, the Rio Declaration, points out, that without involving each individual and the NGOs, and I suggest also the indigenous peoples and traditional communities in this dialogue, we will not succeed in implementing a One Health policy. And if we don't, we are at the peril of another COVID-19. The number and frequency of emerging infectious diseases is clearly increasing. We've known about zoonotic diseases since what we read about ancient China, Greece, and Rome. Tuberculosis was understood. Smallpox emerged in ancient Egypt. And indeed, all of these spillover diseases remain with us. We've only been able to eradicate smallpox. The other diseases are alive and of present concern. So the great bubonic plague that wiped out about 1/3 of Europe in the 14th century is still with us. Further plague pandemics, the 1918 influenza pandemic, which emerged in Kansas and became known as the Spanish flu in the First World War, actually killed more people than the battleground did in that horrific war. But we celebrate those who died in the war and pass on beyond those who died in the 1918 influenza pandemic. We have more recently chikungunya, which came to the Caribbean and then up into North America and the US. 1968, the Hong Kong flu. 1975, Asian flu. 1975 was when Lyme disease began to afflict us. Ebola appeared in 76 and again 2014 and again now. the Asian flu of 75, and the H1N1 avian influenza in 97, and 1999 Nipah virus. We then had the West Nile virus appear in New York in 2000, SARS, the sudden acute respiratory syndrome, SARS-CoV-2 is what causes our current pandemic, COVID-19, but it emerged in Asia first in 2002, and then a similar virus, MERS, and then quite more recently, the Zika, and now COVID. Now, why is this happening? Why do we have more emerging infectious diseases showing up? Well, the evidence is there. There are more people living on the planet. If we put the timeline on the left with the graph on the chart, more people are migrating into the areas of wild nature or even just settled nature. And climate change impacts are also disrupting habitats. And so as the habitats are disrupted, the animals that are the host to these viruses and bacteria can no longer support them. And they themselves migrate, if you will. They look for another host, and they find the host in you and me, in people. And so these trends have not changed. And as Chris points out, migration is going to be another factor that needs to be in that Ecosecurity Council. A picture is worth 1,000 words. So here we are. We have the vibrant biodiversity of a Brazilian forest in the Amazon before and after. The viruses that once lived happily on the left are seeking new hosts on the right. And we need desperately to make the link between these two photos and come up with a management system that works to maintain the biodiversity that we require. We won't get it from the next vaccine. We're very lucky with these vaccines right now, but we don't have vaccines for all those other diseases I just ticked off for you. And René Dubos, who is a great, wonderful microbiologist and thinker, and helped us pioneer the development of the antibiotics that we all depend upon today, perhaps put it best. He said, now over half a century ago, he said, modern man believes that he has achieved almost complete mastery over the natural forces which molded his evolution in the past, and that he can now control his own biological and cultural destiny. But this may be an illusion. Like all other living things, he is part of an immensely complex ecological system and is bound to all its components by innumerable links. Humanity is bound to remain a gamble because at some unpredictable time and in some unforeseeable manner, nature will strike back. We're in the midst of this phenomenon that Dubos predicted now, and it will come again. So I thank you, and I thank this conference for letting me share these ideas that magnify and I think complement the other members of this panel whose contributions I greatly admire. The future, frankly, the future for you and me and this biosphere is in our hands, whether it's action we take locally or provincially or nationally. We have one Earth, we have one health. So I look forward to all our discussions and your contributions to our dialogue, and thank you very much for your attention.
Well, thank you, Nicholas, for a great presentation. And I think your final words and your final slide there were very apt in their imagery. That photo of our globe, the one Earth that we have floating in the vacuum of space, I think really does sum things up for us. You gave us a lot of information there, but you laid it out very, very clearly. I think you showed us very clearly with your very sobering and frankly somewhat terrifying list of emerging infectious diseases that prevention is much better than cure, as you mentioned, as has been said, I think, throughout these presentations, because these diseases, as we know, including, of course, COVID-19, are very, very difficult to manage. And some of them are to date impossible to completely do away with. So I think that was that timeline that you put forward, I think put things into perspective very, very nicely. I think some of the other points you made, obviously the One Health approach speaks for itself really in terms of, again, these interlinkages, whether we call them intersectoral kinds of approaches or, planetary kinds of linkages between these different elements. I think they speak for themselves. And I think you also emphasize that the public is key and communicating these ideas. I think that's very clearly what you were doing with your final slides there. The warnings given to us by some of the specialists, but increasingly, I think some of the people that Mr. Namanya we're talking about in Uganda and others right here in Canada who have experienced the impacts of climate change and whose experience of their own health is declining, whether it's mental health, whether it's other health indicators as well. The public are experiencing these things, and these are our key constituency for making changes for the better. So thank you very much. So again, our main mechanism for taking questions here is the Q&A function. So for those of you who are participants, please do ask your questions now of the three speakers. I will also invite the speakers themselves to think about any questions you have for each other. And I'm going to give you a chance to speak in just a few moments. So you can either invite your fellow panelists to respond to your questions, or you can even go ahead and put them in the Q&A if you want. While we wait perhaps for some of those questions to come up in the Q&A, I'm going to start with, I think, two questions of my own here, okay? The first one is building on something I think that Mr. Namanya said, and everywhere around the world, given the scale of what we're talking about and the complexity, financing is a key issue, right? Getting the funding in place to make these efforts happen on the ground. And finance is kind of the last piece of this conference, which the G78 is going to consider, I think, particularly on Saturday. So Mr. Namanya mentioned, for example, public-private partnerships as one key model for operationalizing these things, for leveraging funding. And I think that's very important. I think, as I mentioned, I know a little bit about the food sector, the nutrition sector, and certainly public-private partnerships in the food security sector are quite prevalent. I think they're quite important, but they have also been treated with caution, especially by civil society, especially by human rights activists, food sovereignty campaigners, because of course some of the big multinational corporations, of course, as I mentioned before, they are responsible for various kinds of negative effects as well of indirect and directly from the commodities that they're selling. So I guess I would ask all of you, maybe what are some of the pros and cons of public-private partnerships in this intersection of health and climate adaptation? Perhaps you might draw attention to examples you already know of, which might be positive examples. So that's my first question. I see that the Q&A has just lit up. Okay, we've got a couple here. John asks, Mr. Namanya, please tell us more about the emergence of malaria in Uganda. So I guess the spread from endemic areas into areas that were not previously endemic. And from Roy Culpepper, he asks, how do we adapt as living beings to living in a hotter environment? Heat stroke is likely a growing cause of death, particularly for the elderly and infirm. Just think of the 500 plus heat-related deaths in 1 week in Vancouver last June during the heat dome. And I know that there were deaths in Europe, I think, this summer as well. So we have two questions there. I have another question myself, but I'll keep that up my sleeve maybe for later if needed. So all of the panelists can speak to these. Let's go in the same order as we did before. So I'll invite Janet, first of all, to speak to any and all of these questions, please.
Okay. First of all, the first discussion around justice and equity, I think that it brought to mind the issues around environmental racism and environmental justice that we're seeing around the world, that people, the most vulnerable, either move or migrate because of jobs, because of crisis, because of conflict, to the least desirable areas because nobody else is there, whether that's a floodplain, whether that's a previously contaminated site, as is the case with a lot of our indigenous people here. And the powers that be allow that to happen. And so the injustice of that, coupled with the health impacts, I think is something that we have to think about. Whether that's somebody moving to the Bangladesh floodplains of a river delta, a more swampy area, closer to tidal surges, and those buildings are hastily constructed, they're poorly constructed, and the cycle continues. So that environmental injustice piece or racism is something that I think we need to bring into the discussion. Around the public-private partnerships, many of us have wrestled with this. Many of us have come up with guidelines for those kinds of partnerships. It was the Canadian Council for International Cooperation, I think it's called Cooperation Canada, has developed guidelines for ethical partnerships. And the Canadian Coalition for Global Health Research has developed guidelines for ethical and equitable partnership for research. Now, whether that's with public-private money, that's another piece. And it all focuses around that core of equity. Is there equity in that partnership? Is there fairness in that partnership? And how is that partnership going to be realized? And I think that's the core of it, whether you're being approached or whether you are approaching, you need to have those core values. And I know in Europe, the European Foundation for Philanthropy, which works very hard partnering NGOs with the private sector, has also done a lot of work. And when I was with the International Organization for Migration, I went to some of those meetings and I was really impressed with the partnerships that were formed, but also the integrity and the kind of guidelines that were produced. So I think there's ways. Not every private business is the best for partnerships, but there's ways to realize that in a way that's sustainable and be equitable and fair. And I think that I don't think we should throw it all out. I know that there's been a lot of discussion on this, but I'm on the camp of let's try to make it work, but make it work with that core of equity. And then Roy's question about adapting to hotter environments. I think that we only need to look to the global south to look at how people live in hot climates. They don't live in high-rise buildings. They have good ventilation. They're airy, and what's happening is that we're in these high-rise buildings that heat up quickly, and schools the same. Very few office buildings have windows that even open. So because of COVID, of course, it's created this huge crisis. You have to have better ventilation. You have to have windows that open. And the buildings are not, we need to adapt the building so at least windows open, and also better ventilation. And think about the structure of that. And if we're talking about adaptation, and that's problematic because you've got these high rises in urban centers being built everywhere. So I think we need to put pressure on the developers to say, how are you going to guarantee that? But then, of course, you're going to suck on the electrical grid in terms of air conditioning, pollution, et cetera. So how do you do that without sucking on the other, creating more issues around climate change? Thanks.
Thank you so much, Janet. Okay, Didacus, do you want to lead us off now?
I would like to respond to the question on the emergence of malaria in Uganda. I want to mention that the whole country, 95% of Uganda is malaria endemic. That means that there is a prevalence of malaria in 95% of the country, where the conditions are very supportive of malaria occurring. Previously in Uganda, some regions of the country which are high altitude, high elevation, maybe over 1,800 meters above sea level, the southwestern Uganda highlands, the highlands in eastern Uganda around Mount Elgon, and then in the western around Mount Rwenzori. They had no malaria completely, like before the 1960s. The map of malaria prevalence excluded those areas as malaria-free zones. But coming to the 1980s, 1990s, these are now epidemic prone because the people, even in those areas, the indigenous people in those areas have no immunity of malaria. So there are common epidemics in those areas, in the highland areas of Uganda, due to that climate change, because the temperatures have increased and support the multiplication of Anopheles mosquitoes. And when the rains come in, the flooding and the stagnation of water supports a lot of multiplication of mosquitoes, which cause a lot of epidemics in those areas. This was previously not the case. And so it is attributed largely to climate change. It is the same thing with other highland areas in East Africa, in the Kenya highlands, in the highlands in Tanzania. Studies have been done and they have established that the climate change which has occurred leading to increase in temperature has led to the increase of the range of the malaria mosquitoes, and therefore these areas are prone to epidemics. Perhaps before I end, I have a comment on the One Health. I'm impressed that Professor Nicholas, you have talked about the One Health approach. In Uganda, we have actually taken up this approach. I'm aware that we have developed a policy and a strategy, and the three sectors, health, animal and plant sectors, agriculture, we are operating to implement this policy. And under the framework of climate change as well, the Ministry of Water and Environment is coming in to strengthen this intersectoral collaboration. So I'm happy that even at international level, it is an approach that is promoted. And we think this is the way to go because health is cross-cutting. It is affected by many sectors. It's affected by transport. It's affected by water, agriculture, nutrition, even wildlife. We have these Ebola cases, Ebola epidemics occurring in the African region, and it is because of the interaction between humans and nature. So you brought it out very well, and it is one way that we should strengthen the collaboration between the North and the South so that we can tackle this issue very well. Thank you. Over to you.
If I could interrupt, I know that the Institutes for Health Research have done some major funding in terms of One Health networks. And I think there's 4 networks now that have been funded across Canada with North-South collaboration. So I think we need to keep an eye on that in terms of what the evidence they're building and their collaboration. So I think that's very, it's a nice thing to know about.
Yeah, we can take it forward from here.
Yeah.
Great, thank you. Nicholas, do you want to go ahead and respond to some of those questions? And there are other questions as well in the Q&A, so I'd encourage the panelists to have a quick look at some of those. Maybe we can have one more round, perhaps after this, of responses.
Well, I thank you, and I thank Didacus for his point on the developments in Uganda. I think one of the interesting things about adapting a One Health policy or any climate policy is it doesn't matter from a political or social sense whether you're rich or poor, east or west, north or south. If you're intelligent, you can organize. And the political organization is the first step. After that, finding the resources, finding the expertise and all falls into place. But let me return to the Roy's question on heat. It's not just the heat dome that we saw in the Pacific Northwest. Out in the middle of the Pacific Ocean, there has been a very big heat wave. Marine biologists call it the blob because they have no better name for it. The water heats up so much that it kills all the life that has evolved and lived in colder water, and the food chain is interrupted, and it even wipes out hundreds of thousands of birds that depend on that food chain. So we're creating heat waves for nature, as well as for ourselves with our urban heat islands and our. So what do? Well, number one, we start planting trees. And if we do it, as Janet says, equitably, we're going to have trees prioritized in poor neighborhoods or public housing areas or areas that need the relief because they may not have the advantages of the air conditioning and so on. We need to create local parks. And as we do that, we need to strengthen the parks that exist and create buffers so that the animals in those areas are healthy and don't have the chance to infect us with diseases as the diseases come through. We need to have a better management system for mosquitoes and disease vectors, because as we see in the malaria situation in Uganda, these disease vectors are more frequent in North America. If you don't have a cold frost that kills off the mosquitoes, they populate even more, and we're losing our cold frost across North America. It's going further north. So we need to manage our habitat from a health point of view, and not using mass amounts of chemicals and pesticides as we have in the past, but a much more sophisticated living with nature approach to it. And as Mayor Bloomberg pointed out when he was the mayor of New York, he planted 1 million trees, and it took him much less time than the experts said it would. And he wanted a park within 5 minutes walk of every person in an apartment, so they could leave their apartment and go out and sit under a tree and have that cooling environment. And there are endless numbers of studies that show that if you're happy in nature and you have access to natural areas, your mental health is better also. So you're better equipped to be resilient. Now, this was done in New York and elsewhere through public-private partnerships. That question that Chris came up with. The municipal park people never have much money, and they have been able to get from real estate enterprises support for planting trees, which frankly make the real estate more valuable. People like to live near trees. And the brokers for this are often the non-governmental organizations that can approach those with resources, financial support, and steer the money into effective projects and hold the systems accountable. I would point out that this is being done on a continental level in Africa with the Green Wall, the Great Green Belt that's being created by the African Union all across Africa to stop the desertification from spreading and basically to create a healthy space for nature across the entire continent. Africa is doing this on its own initially. They didn't wait for international assistance. They took a leadership position globally. And I think it's just outstanding. It's brilliant. Now they're suggesting that the World Bank and others should line up and support the effort and get it over the top and make it happen. But if we can revegetate a green swath across all of Africa as a model for how to do this, we can do it anywhere in the world. But we have to use that leadership and not wait. Frankly, the emergence of biodiversity loss as a disease magnifier should and this COVID-19 example should make us prioritize this, as we never have any policy before. I am not sure we're going to, which is why I'm sort of insistent in my tone of voice. But thank you very much.
Thank you, Nicholas. So we're getting very, very close to time. So what I'm going to do, I'm going to challenge the panelists to respond within just, 1 minute each. So we have a question here, I think, which is quite interesting. Irvin Waller says, Janet mentioned the Sustainable Development Goals. Can you say more about how these help get the transformations that are needed? How can Canada become a leader instead of a follower on achieving the SDGs? Perhaps, Didacus, when it's your turn, you might speak to how Uganda experiences the SDGs. Are they a real and important planning goal? I can say that for some of these goals, like the goal on food security, we seem to be hopelessly off track for that, but perhaps we are more on track for some of the other goals. So with only a few minutes left in the session, I would challenge each panelist to respond very briefly to that. But again, if you see other questions in the Q&A that you think you're particularly well suited to respond to, go ahead and respond to those. But let's be quite concise, please, with our answers. So again, we'll start with Janet, if you don't mind.
I think I'll leave I put my point forward on the SDGs. I think that this has been hijacked by vertical programs. I think that it's not a very powerful focus anymore. I would like to address the early warning systems issue. I know a fair bit about this. I would like to point out to everybody that Canada was the global lead for the Global Public Health Intelligence Network, which has used AI to gather intelligence globally on events, environmental events, conflict events, and then outbreaks. And that whole system was crashed by the Conservative government, and the people were dispersed. And now our government is trying to patch it together. But right now, the Public Health Agency of Canada, all the experts are not there, and they're no longer interested in being the global leader. So WHO has transferred a lot of that over, but there is no one right now that is doing that global health intelligence alert system that Canada was the lead on. And I think that when you're talking about examples, that one is an amazing example that gathered all that information together, and it's gone. So we need to, if we're going to take action from this group, I think that's something we could talk about. Thanks.
Thank you so much for keeping to the time and being straight to the point. Thank you. Didacus.
Yeah, thank you for the opportunity. Regarding Sustainable Development Goals, I need to mention that these are a framework which we use in planning, developing plans at the national level, developing strategies in the health sector, because they touch on targets which we need to meet. So we have been using the Sustainable Development Goals in developing our policies. They are integrated, greatly integrated in our policies, in our strategies, because we'll have to work. Uganda is a signatory to these goals, and we have to work within that framework at the global level. Perhaps I also want to mention that regarding Canadian support to international development, especially research in the climate change area, I have been privileged to work on research projects which have been supported by IDRC. The main one has been indigenous health adaptation to climate change. If you Google search, you will be able to see a lot of work we have been able to do. It is a tripartite research initiative which targets indigenous people. In the Arctic, we have been looking at the Inuit. I think you know them well, how they survive in the north, which is a very complex and complicated environment, but climate change has definitely affected them. Then we have the Batwa in southwestern Uganda, who used to live in the forest, but the government removed them from the forest in order to protect mountain gorillas because of the zoonosis, which you mentioned, to prevent the transfer of diseases from the wild animals to the human beings and to cause those such pandemics. Then we have also been working with Peru, the Shawi and Shipibo also live in the forests. So Canada has been very instrumental in these initiatives, and we have generated a lot of research findings, publications, which have been now taken up to inform policy in that area of climate change and indigenous people. Thank you for the opportunity. I submit.
Thank you very much. Nicholas?
Well, by coincidence, in August, Narendra Kekar and Veselin Popovsky and I published a book called Fulfilling the Sustainable Development Goals. Rutledge put it out. So there are 500 pages of chapters, including ones on zoonosis and the pandemic, which of course was not addressed in the SDGs, even though it could have been. It's generally there in the One Health. But I tend to agree with Janet that the SDGs call for integration, but everyone is so well siloed, there's not much integration going on, and therefore we need something more compelling. And if a pandemic cannot be compelling, what will be? So I think pulling the parties together through a One Health paradigm, a One Health approach model, may be a way to cause us to finally use the SDGs as they were intended, to be integrated. I'm a great supporter of the SDGs, but I think we have to get some wind behind their sails. They're halfway toward 2030, and we're not halfway there implementing them yet.
Thank you very much, Nicholas. Interesting to know that you literally wrote the book on that topic. Good to know. I want to thank all of our panelists very, very much for, I think, an excellent job in tackling a very complex set of issues, articulating them very, very clearly, and responding to these questions. Thank you to the participants. I know we didn't get to all of the questions. Some of them were more specific than others. If any of the panelists feel like trying to respond to those questions in the Q&A, just typing in your thoughts before we finish, you're very welcome to do that. But we do appreciate all of the questions and the interest. Before we go, I'm going to give you a quick overview of what's happening a bit later on in the week. So to let you know and remind you that this conference is continuing. So tomorrow at 12 p.m., there's a keynote address by Bob Rae, currently the Canadian ambassador to the UN, but we know he's had a very storied political career here in Canada. So Bob Rae will be speaking to Canada's role in the global context. And that keynote will be followed tomorrow at 1 o'clock by a session on communities fit for the future, municipal leadership, donut economics, and adapting to a changing climate. And there's a number of councillors in the city of Nanaimo. I think Richard talked a little bit about that in the introduction to this panel today. So experiences of the city of Nanaimo, which has tried to actually operationalize that donut economics model. So that promises, I think, to be a very interesting and possibly a very practical set of discussions. So I do hope that everyone's going to attend these other sessions, and the conference continues later on as well for the rest of the week. So again, thank you, everybody. Thank you also, Sarah, for the technical support behind the scenes. Thank you to the organizers. It's been a great pleasure to moderate this session. So with that, I will close the session. Thank you very much, everybody, and enjoy the rest of your day.
Thank you.
Thank you.
Thank you.